Hello, everyone. Welcome to Their Journey, a sit down with the National Digest. I'm your host, Eric Mastrota, and today I have the pleasure of once again speaking with Dr. Allan Gold, a retired school psychologist who spent his career and life creating spaces for kids in school to feel heard, informed, and safe as they come of age. Today, we're going to dive even further into what this truly looks like and discuss more about what kids are experiencing when it comes to their mental health and forming their own identity. Hi, Dr. Gold. How are you today?
Okay, how are you?
Doing good, doing good. In our previous conversation, one of the things that we just kind of briefly discussed that I think would be a good place for us to start today is about the planning and discussions that should take place between a couple or a family before they take that step of having children. For you, why is this integral? And in your opinion, what should these conversations look like?
Okay, it's a very good question. And the older I get, the more I really realize how important it is for all couples before solidifying their relationships to have couples counseling. Okay? This is even regardless of children. So I realize more and more that how each of our upbringing by our own parents and families really determines our personality, our values, and our sense of self. And it's very important to recognize, for example, I'll give you a bunch of examples, what love means to each partner, how it's expressed, what annoys each partner, how each reacts to challenging situations, their willingness to discuss when they have disagreements or different opinions. Um, can they accept constructive feedback, not nasty feedback, but even constructive feedback? And by that I mean if one partner is doing something that maybe bothers the other, or they're concerned about the partner, can they accept the feedback, or do they take it as an offense and uh, derision? Um, are people able to change their habits if necessary? Um, One doesn't find these things out until one actually discusses them, or they happen and then there's this reaction to them. How defensive is one or the other or both? Are they very defensive if they do something that is criticized or isn't accepted? How self-critical are they? How blaming of themselves? So all of the normal challenges of life can set off any of these reactions. Now, having children will present situations that may evoke disagreements that might not have arisen with just the two people. Two people may seem like they're pretty okay and get along and can resolve conflicts and so on like that, but throw children in, and it's not uncommon that parents, particularly new parents, will react differently to situations that the children present. Okay, often based on how they were raised themselves. For example, some parents really like the way they were raised and they want to raise their children in exactly the same way. Others may want to do the exact opposite of the way they were raised because maybe they recognized a lot of the negative aspects of how they were raised and don't want to repeat that. So these views may coordinate with each other. Maybe the opposite of one matches very well with the um, similar raising that the other partner has, or they may be like this. They may not coordinate at all. And that's why pre-parental and pre-marital counseling can be so helpful. Um, Children are always going to present situations that parents have to respond to. So how do you handle it when a little kid, 3 or 4, says, "No, I don't want to do that"? How are the parents going to respond? How do you handle disrespect? You're the worst mother in the world, that kind of thing, or father. What if your kid breaks something and it's an accident? What if they break something on purpose? How do you handle that? What if he or she is really very disrespectful and swears? I'm talking about older kids now. What if they don't do their homework or their home chores? How do you handle that? What if they're stuck on their computer and won't get off? What if you catch them drinking or smoking or having sex even? What if they're being mean and bullying other friends, I mean, just having children, parenting is one of the hardest jobs in the world. And so all of these issues that are very serious, it's not just like a trivial thing like the ice cream fell out of the cone or something like that. But so these are complicated situations, and many of them, they need parents to be on the same page to handle the discipline, handle the advice, and handle the interventions. Okay. So and kids are extremely clever at manipulating parents. They can figure out, oh, I can ask my mother to do this because she'll let me, but my father won't. Or it might be vice versa. Um, so that's why it's so important to have a coordination of how parents might react to a particular situation, um, even if they don't have children and it hasn't happened yet. That doesn't mean it's going to be perfect, but when kids, you don't want parents to be caught off guard and surprised. Um, like, I don't know if I mentioned last time, but I had a seventh grade mom come to me because she caught her seventh grade son looking at pornography.
Mhm.
Um, and, that's very surprising. But had she thought about, what if I catch my kid, or, mom and dad talk about it, what if we catch our kid watching pornography or doing any of the things that I mentioned? How can we respond to that in a way that um, we both agree on how we should respond to it, and we might be able to have an effective intervention. So in general, it's very useful to discuss values because that's the core of how we respond. And it's so important for people, not just parents, but I mean all couples to see if they have similar values about things. What's really important in your life? About reactions. How do we react? One parent may just blow up and get angry. The other parent may be much calmer. Um, and then talk about possible interventions beforehand. Um, you may not know exactly what to do, but if you have some ideas, okay, if my our daughter is very disrespectful to us, how do we want to handle that? Do we want to lock her up in her bedroom? Do we want to take away privileges? Do we want to address the disrespect? Do we want to question her and find out why she's acting that way? So, uh, just being prepared, I think, is so important. And there's always going to be surprises where, parents are not prepared. But the more one can do that and coordinate their responses, particularly for the serious um, situations or events, that's very helpful. Does that kind of explain why?
Definitely. Yeah, definitely emphasizing the preparedness, and it's really important for sure. And something else that we also touched on a little bit in our first conversation was about your own life and moments of self-advocacy that you've endured that helped you when it came to helping children throughout your career as a school psychologist. So I'm wondering if you could talk a little bit more about the personal triumphs that you've overcome that have helped you when it came to helping all those students.
Yes. Well, thank you for asking that. And because I'm pretty comfortable talking about
Mhm.
my own history, I will share. So, my personal triumphs probably are focused on quite a few challenges that I've faced throughout my life that I've been able to overcome or at least deal with. Okay. I don't know if I mentioned last time, but I had polio when I was 8 years old.
Mhm.
1 week after I turned 8, I was diagnosed with polio. It was the year before they um, discovered the Salk vaccine. Fortunately, I was young enough not to be terrified, um, but I had to go into the hospital for 3 weeks and be at home for 4 months in bed. And, so it was a challenge, and I was just starting fourth grade then. And so I missed school. So I had to get over that. I had to be be given exercises so my muscles wouldn't atrophy and all that. Um, Certainly when I was young, I was teased and bullied for because I was very small. My parents were both not very. My mother was 4'11" and my father was 5'4", and I mean I'm taller than that now. I, I did get taller eventually when I was about 12 or 13. But people would tease me for being little, and I wasn't an athletic person. So I was in situations where um, I was made fun of. So I had to overcome that. Fortunately, I was a really good student. So people recognized that. And so it didn't tease me about everything. Um, then recognizing my sexual orientation when I was young, but I didn't have the vocabulary for it. I came out as gay in my late 20s. I mean, I knew that I was for a long time. I actually was married to a woman when I was 23. We met in college, and we're still actually good friends. Um, but we divorced when I was 27, and not necessarily because I was gay. I think we were just very young and didn't understand relationships, that I was talking about a few minutes ago. And but I was really, neither her parents nor my parents were divorced, so I hadn't really experienced that. And it was tough. It was depressing, and I it hurt. So I had to overcome that. When I was 40, I was diagnosed with HIV, and at that point there were no medications, and this was 1986, and I didn't know if I was going to live or die. And I lost about 70 acquaintances and at least 10 really good friends who died of AIDS back in the 80s and 90s. So I had to get through that. I had to um, get through my first two male partners leaving me after 5 years and 8 years. Well, I'm not sure why they did, but we had long relationships. And then when my parents died, fortunately, I got to be 50 when my mom died and 56 when my father died, and they were 43 and 48 when I was born. So they told me, and um, when I became an adult, I guess, they said they were worried that they wouldn't even get to see me be an adult. But my mother lived to be 93 and my father 104 and a half. And but yeah, so I'm in competition with him. I got to beat him. But even if they were old, when one loses one's parents, it's a loss. You have to um, get through that. And then at age 69, I was diagnosed with prostate cancer and had to be treated for that. I was in a really serious car accident 3 days before everything shut down for COVID. And I broke or fractured 6 ribs, and my hand was a mess. So I had to deal with that. Fortunately, it wasn't super painful. And then I had to care for my husband of 29 years. He had Parkinson's disease, and for a long time it wasn't a problem. But the last 3, 4, 5 years, well, last one or two for sure, it was very, very difficult. And he was in the hospital, and I had to retire because I couldn't take care of him. And work too. And he died a year and a half ago. So that loss and retirement, were very difficult. So I'm only I'm not looking for sympathy or, oh, poor Alan. But all of those events, were very challenging, and so what it really helped me to do was realize what's necessary for adults or kids to get through really difficult situations. And, I realized that, these were all challenging events, and I had to muster some strength and resilience and a positive attitude, even humor. I didn't mention like 2 years ago, I had to have some skin cancer removed from my head. It was a 9 hour process, not digging around for 9 hours, but they had to take off skin and and then look at it in the microscope and stuff like that. So I had to, I used humor when to help me get through that. And so I think being able to use these events as a way to put life events into a perspective really helped me teach kids how to handle anger and anxiety and disappointment um, and find resilience. Resilience is such an important word, and get through their difficult or maybe not so difficult situations. Um, I don't know if I mentioned before, but I used to teach kids how to a process for managing anger. Did I mention that last time?
I think briefly, yeah, but
Yeah.
yeah.
So, I can repeat it, but, I would have kids rate things on a 1 to 10 scale. And we would start out with something fairly innocuous, like how much do you like broccoli? And one is I can't stand it, and when I hear the word, I throw up. And 10 is I could have broccoli for every meal of every day. And I would, if kids ever said 10 about things, I would try to correct that a little bit because that means you don't want to do anything else in your life.
Mm,
So if how much do you like reading? Oh, 10. Well, that means you don't do anything else. Or how much do you like soccer?
right.
10. But most kids would, if they really liked something, they'd give it an 8 or a 9, or if they didn't, like a 2 or a 3 or a 4. But then I would ask them, um, what I said, this is a really hard question. What's the worst thing you think could happen to you or anybody you loved?
Mm,
And many kids would say, well, they could die. And sometimes I'd have to direct them there. But I'd say, so let's say a 1 is death or a horrible illness or a terrible natural disaster
mm,
or an accident or something that's really, really awful. And 10 would be like a perfect day where everything
right.
goes well. And then I would ask them, where on that scale, where would you rate um, your friend ignoring you at recess, or you're getting a B on your math test,
Mm,
or somebody calling you a jerk, or some other language? And most kids would say, oh, well, that's about a 5 or a 6 or, something like that. The kids I would worry about would be the ones that would say that's a 2.
mm,
And because they were overemphasizing, they weren't putting it in perspective. Um, but most kids would, and I'd say, yes, you have every right to be annoyed or disappointed or hurt, but nobody's dying. And and it's really important to be able to put that in perspective. And I would ask kids, why do you think I'm trying to teach you this? And they really didn't know. And I said, because when we have very extreme reactions to situations, our brain isn't working very well.
mm,
If we can calm ourselves down and think, okay, how can I handle this? Maybe I just need to walk away, or maybe I need to tell the person, that really hurts my feelings. Can you please not do that? Um, there's a greater chance that we're not going to just have a reaction, a gut reaction. Um, did I ever tell you the story that happened to me? It was about 8 years ago, or 7 years ago. Um, I came home from school and my microwave wasn't working,
mm,
and I blew up. I was swearing at it.
mm,
I was stomping up and down the stairs, and I actually had to give a talk at my synagogue the next night. And I was afraid I would lose my voice.
mm,
And I said to myself, and at that point I was 72 years old, I said, Alan, why don't you listen to what you teach other kids about handling anger?
mm,
And it took me a long time to do. I wouldn't get angry that much at, other people, but, if electronics weren't working or something, or I was stuck in traffic, I could get. And since that time, I haven't gotten angry very much.
Um,
I mean, I might be angry at what's going on politically or something like that, but in terms of, relatively minor events, I don't have that strong reaction. And I worked with kids who really were able to learn that process and calm themselves down and not have a reaction. Does it work all the time? No. Does it take practice? Yes. And self-awareness. But it was a good strategy. And then I think the other thing that has to do with self-advocacy, which you asked about, um, having positive self-esteem enabled me and enables one to not feel restrained or bad or deserving of bad events in your life. Because there are plenty of people who think that they deserve the bad things that happen to them. And if you need to advocate for yourself, you need to have some strength. You have to have a sense that, I'm a decent human being. So, even if you have that, um, you may not be really strong at it, but at least you have some ability to advocate for yourself. So if you believe in yourself and think that your needs are valid,
yeah,
um, then we allow ourselves to ask for what we think we need. Because if we don't ask, we're never going to get it.
yeah,
Well, I won't say never. Sometimes people give us stuff that we want. And it doesn't mean that we always get what we want, but without asking, there's much less chance that we get it. And I would say one of my best self-advocacy events was when I wanted to go back to school to become a school psychologist. And my father, who was pretty controlling and, wasn't terribly flexible, told me to stick with becoming an actuary. They're the people that um, design or calculate the insurance premium. It's a statistics, and based on my background in statistics, I was wor working on that. But I refused to follow his strong suggestion. It wasn't like a total command. And I followed my own internal desire, and it was one of the best decisions I ever made. So I was able to advocate for myself. Not that I can do it all the time. Sometimes, people, um, again, it all depends on people's personality. And, but it takes some guts and it takes good self-esteem to feel like, yes, I have a right to ask for this.
yeah,
And if I don't, chances are low that that I will get it.
yeah. Right, right. Well, yeah, I mean, first of all, thank you so much for sharing so much of your own story too. And I love that the overarching idea of resilience too, as well, and using resilience as a way to manage your anger and how you respond to things and ideally build a self-esteem for yourself too. Because, one of the general issues that kids have always faced and are still facing today is things like bullying and just kids being unkind and mean to each other in general. And while it's something that's always existed, it's definitely been kind of amplified to a different way in our modern world. And so I'm wondering, in your opinion, how much of this do you think has become amplified from the increase in exposure to meanness, bullying, and teasing that we see on social media and the negativity we see, particularly from people in power or people who quote unquote should be considered role models for kids?
Yeah, no, absolutely. I definitely know that it has increased. When I was growing up, I mean, even in television, you maybe haven't heard of Leave It to Beaver. It was a television
Mhm.
program in the 50s, and
Yeah.
and there was a kind of a mean kid there, but the worst he was ever was a little bit sarcastic, but they never used bad language and it was never horribly putting down other people. I absolutely believe that it's been unleashed and exacerbated by exposure to social media and national and even international role models who show no inhibition in what they say and call others in a very public way. You know who I'm talking about. Um, I'm not saying that meanness and bullying haven't always existed. I was telling you earlier, yeah, I was kind of bullied and teased, I think I don't know if it's in every culture, but it's certainly in American culture because um, independence and, one-up personship is really part of American culture. You want to be better than other people. And one way, I mean, the right way to do it is to practice skills and just get better at something. But the wrong way to do it is I'm better if I put down somebody else, and it's cruel, it's unempathic, and it increases, and so it's always existed, at least here. And but the freedom of expression that social media has provided, when anyone can post any message based on immediate feelings, particularly anger, it really strongly limits everyone's ability and control to reflect on the possible impact of those words. People don't, if you're facing somebody, you see their nonverbal expressions, the words that what impact what you say to somebody else. Not that that doesn't stop people, but people don't do that as much if they're facing somebody. And it's the whole social media thing has really made it much easier. You're mad at somebody, you just post something, and you don't discuss it. You don't, I mean, conversations like we're having take a lot of words and it's a lot of communication. But just posting something, whether it's a like or something mean and nasty about somebody, it's there. And it doesn't go away either. People saying, I certainly saw over years, kids would bring their phones or parents would bring their kids' phones with all these text messages that are very, very cruel. And but I also strongly believe that people in power, whether they're political, the President of the United States or other countries, or famous athletes or actors or actresses, state politicians, business executives, even principals or teachers. It's really important for them to watch how they talk to other people and talk to kids, and parents. So when they use negative language to describe someone else or put down groups of people like immigrants or religious groups in a very stereotyping way, um, that unleashes the practice among kids to do the same things with their peers. And we think that kids are not aware of what's going on, but that's completely wrong. Even little kids are very aware of how their parents talk, and what they say about other people, and they're, aware of, what's on television or radio. So, and the older they get, and then they certainly hear what other kids are saying at school, and how they're putting people down. So I consider it a very, very difficult thing, and it's so important for, leaders of countries to recognize that how they treat other people, um, or how they speak about other people has a huge impact. That's one of the things I feel the most angry about, frankly, with this current administration. I'm not going to pretend that I don't feel that way. But hearing or, seeing or hearing that kind of language or behavior just gives kids permission to do it. And, it's, it's very it's catching. It's almost addictive, and all we see and hear now is degradation, and everything's very, very complicated. An interesting topic that I was that kind of shows how it can be handled. So we have a state senator named Scott Wiener who's Jewish and gay. And recently he was saying that what Israel was doing to Gaza was genocide. And he was criticized for that by a lot of Jewish people, agreed with by other people, and in the local biweekly Jewish magazine, there were several articles and also letters to the editor about that. And it's very, very complicated. Somehow or other, what's going on now is sort of black and white, all or nothing. And everything in life is very gray. So I've had some conversations. Do I really believe that what's going on, and I'm Jewish too, do I believe that what's going on, what Israel's doing, I don't think it's right, but is it genocide? And I've always associated genocide with what Hitler did to the Jews in the Holocaust. But if you look at definitions and I could see how some people would consider it that way. Not that I'm saying what Israel's doing is correct in any, but you know, but I think it's a good example of how everything is, has nuances and subtleties. Look at what this administration is saying about immigrants. They're all rapists and drug cartels and all that sort of stuff. And by stereotyping any group, it all it does is attract more negative comments and prejudice, which is really awful. Uh, that yes, every group has bad people. I mean, look at Jeffrey Epstein. I hate to say it, but I'm pretty sure he was Jewish, but doing all this, you know, using young women, it's awful. I think if a gay person is a bad person or a Jewish person's a bad person, that's worse. But you have to realize that every group has people that do the wrong thing. But we don't have to stereotype the entire group and make everybody, every immigrant, every Jew, as a bad person. But you know, uh, so I also feel, particularly how important, as I've gotten older, how important communication is in life. Everyone may have a disagreement with somebody else. Just as I was mentioning this view of genocide, but everybody can be annoyed by somebody else.
Right.
But how we communicate our differences and our disagreements or our concerns is critical to how and whether they'll ever be resolved in a positive way. And how our leaders, including this president, communicate becomes a role model for all people and must be handled in a respective, positive way. So it takes effort. It's so much easier just to blast somebody or say, call them stupid or whatever you're going to do it. But to really try to understand other people's views, why they have those views, what may match, um, and I've worked on that with other people that I mean, fortunately, most of my friends are pretty agreeing with my views, but I have a few very close friends that have different views, and I try to understand. So rather than put them down or call them stupid or whatever, I try to ask questions and understand um, why they might have that particular view.
Yeah. Right. No, and in that same vein, when we, to get a little more specific too, looking at topics like gender identity, sexuality, and identity politics in general, in terms of talking about those topics, these are things that have, of course, always existed, but they've become more again, quote unquote, mainstream, just in terms of how much more we talk about the issues surrounding them and how much more access to information we have with the internet and everything like that as well. So, for you, when looking at that sort of shift and that major shift, what are some of the positive and negatives that continue to exist that always have existed, but what have we also mainly seen improve in that regard?
Yeah, no, excellent question. So, since I was young, these topics, gender identity, sexuality, and identity, um, are much more able to be talked about.
Right.
You know, back in the 50s when I was a kid, nobody talked about this stuff. And until the late 60s when gay movement became much more out there, there's much more awareness of variations in gender identity and sexual orientation, and more people, I think, are accepting of the differences. Now, that doesn't mean that parents and family members may still have difficulty accepting their child's differences. But for a long time now, there are groups to support parents and friends, such as PFLAG, which stands for Parents and Friends of Lesbians and Gays. And so there are groups that are designed to help people cope with this. And I'm not sure, but I would imagine there are groups for parents of transgender kids as well. But a lot of it depends on, because you asked, how have we seen it improved? There are areas, um, residential areas, people where people live, where it's still, decades ago,
Yeah.
probably rural areas too. But depending on the culture and the history of one's residence, that affects accepting as well. So I live in San Francisco and in the Bay Area, and that's a wonderful place. It's a gift. Um, because being gay, lesbian, bisexual, non-binary, transgender, that has been accepted for probably 50 years now, at least. But it's not true for other areas of the country, and which is also why a lot of LGBTQ people come to big cities because they can feel more comfortable and accepted. And my experience in the past few years of working with transgender kids and their parents, at least in my school, when I'm not talking about tons of kids, but, two, three, four, five, six, parents were much more accepting than even I expected them to be,
Oh,
because when you raise a child and you expect it to be, um, act its gender of birth and then they change, that I really feel for parents who have to deal with that.
yeah.
But another thing that I've come to emphasize is that we all have to realize that sexual identity or sexual orientation are only parts of who a person is. They have the whole rest of their identities, their personalities, their skills, their values, their social interactions, and so on. Um, so when we stereotype and label somebody and define somebody by their sexual orientation, um, that ignores the fact that, it's still the same kid, or the same person. And they may be good, bad, or in the middle, or, they're not, I don't like to say good and bad, but you know what I mean. There's everything else about them. And so it's important to accept them. And so, I think there's been a lot of positives over the last 5 decades. However, what this current president is doing to raise prejudice and anger at transgender people, to me,
Yeah.
is horrible. There's so few transgender people, and they're mostly victims, and they're not criminals. Um, and the prejudice against them is very, very hard for them and must change. Now, the one area that I've sort of thought about is male to female transgender athletes.
Mhm.
There may be like a handful of them or something. Should they be allowed to play? I mean, to me, high school or college doesn't make any difference, but if it's in the Olympic or a professional a sport, I like the one of the solutions was if a transgender man to woman wins a sports contest, then they also give a second prize or a first prize to the um, birth woman by birth who might have gotten in second place or something like that. So, it's that I can see as sort of a difficult situation, but I don't understand the fear because, male to female take women's hormones, and so they're not particularly as strong as
Right.
men, I don't think, so anyway, but overall I would say that um, it's a much more accepting, it has been, but I think the prejudice against transgender, like states that have said we don't give care to transgender kids anymore. Um, you know, I mean, I certainly believe that anybody who comes out as transgender um, does need a lot of counseling, particularly before they have any surgical interventions and stuff like that. But no, it's a big deal.
Mm.
I, but I know people who, well, in my synagogue, actually, there are numbers of transgender female to male and male to female.
Mm.
Um, so I'm much more used to interacting with transgender people, and in school, over the last before I retired, the last 2 or 3 years, I really was dealing with transgender kids, and they were pretty accepted by everybody else,
Yeah.
and fortunately, their parents as well.
Nice. Yeah, no, once again, it's like what we've mentioned before, me and you, just about how like nothing in life is black and white. It's a
Yeah.
lot of gray area, which is also why just having constructive conversations and looking at the information and trying to hear both sides is so important. So to even zoom out further, when we're looking at identity in general, identity meaning sexuality, gender, race, ethnicity, religion, etc., why, in your opinion, is having open and candid conversations regarding one's identity in any context so important for development and coming of age, specifically for kids and teenagers?
Yeah. Well, as I said earlier, communication is so important. And, not all people, kids or otherwise, kids or adults, are willing to discuss these things.
Yeah.
But, if they are, it helps other people, it helps them define how they're really feeling
Mhm.
and be able to, identify the feelings rather than just acting on them or holding them inside, that kind of thing. And it really helps, if you have discussions about it, it helps kind of normalize the differences that young people experience. So they can be much more accepting of themselves, regardless of the difference. Whether it's, they speak a different language or they're a different color or they have learning disabilities. I think I might have mentioned about 10 years ago, I started a club at middle school called the T Club. It was Teach Equity and Acceptance. And we talked all about, we had, 2, 3, 4 sessions different uh, about differences. It could be gender differences. I mean, just like men and women. It could be sexual orientation differences. It could be racial differences. It could be religious differences, um, appearances, that kind of thing. But it could also be differences that are not visible,
Mm.
like learning disabilities or emotional challenges, things like that. And just so we would talk about, and kids were pretty enthusiastic about learning about these things. How do we handle these things as somebody with differences,
Mm.
and how do we treat people with differences? Um, so, I think it's very hard, particularly like from about fifth to seventh grade. All kids kind of want to be like everybody else,
Mm.
So how do we handle and accept our differences? And I think talking about it um, helps us. whatever we don't want to talk about, if we can talk about it, it makes us more comfortable and more accepting, and it kind of normalizes that, we're all different. And in many, many ways, we're all the same. You know, we we all, cry if we have an accident and we're hurt. We all laugh, not necessarily at the same jokes, but we all like to laugh. We all grieve if somebody passes away and so on. Um, and particularly, what's interesting, particularly for middle school, and I would even say high school, is that this it's a time when kids are trying to figure out who they are. So, obviously, if you've got black skin or dark brown skin or you're Asian or something like that, you've got that figured out, but you don't necessarily know how to approach that. How how do you def how important is your racial identity or all those different kinds of things. And how do you present that to people? Do you have to be defensive about it? Do you have to be aggressive about it? All that kind of thing. But with sexual and gender identity, particularly in middle school, there's maybe peer pressure to non-conform. Uh, so because kids are experimenting with who they are. I worked with numbers of kids who would define themselves as non-binary at one point, and then they'd be back to whatever they were the next year. That's why I think for particularly for kids who may define themselves as transgender, that they really do get some counseling and really figure out, is this who I really am? And the ones that I believed the most were the ones that, like, if parents would come to me and say, my daughter, when she was 3 or 4 years old, said, I don't want to be a girl. I don't want to dress up like this. I feel like I'm a boy. I trust those early awarenesses kind of more than I do like middle school kids who may be just trying to play around with their identity.
Yeah.
Not that I'm denying it, but just, it's just, and I never even told kids that, when I had groups, but um, I just want to be a little bit cautious that maybe that's just part of being, an early adolescent and seeking your identity. But I definitely think therapy is extremely important for anybody who does consider themselves transgender before there's any medical or surgical interventions. But I think just being able to talk about whatever it is, how do you handle I used to talk to kids all the time about, if I diagnosed a learning disability, because how did they take that? Oh, I'm so stupid. No, you're not stupid. This is because your brain is making it a little bit hard for you to look at a letter and figure out the sound that goes with it. But that doesn't mean you're stupid. Kids need a lot of help with accepting differences. And it could be differences of height and weight and um, glasses or, all kinds of things. Everybody's different. But I think talking about it is super important to just get some being comfortable about it. I remember a fifth grade girl. Um, I met with her parents. She had to use hearing aids and her hair covered it. But we were worried because she was going to go to middle school and, she was worried and wanted to hide it from everybody. So we had a discussion. It was a principal, a teacher, and her parents. And I don't think she was there. But anyway, we talked about if you can tell your classmates, and all the classmates already knew it actually, but after that conversation about it, she was very open and she could get up in front of her whole class and say, I wear hearing aids. And, it kind of wiped out the differences.
Mm,
There was another situation I remember where a sixth grade boy started having alopecia.
mm,
Alopecia is baldness. It was sudden baldness. And it was very hard. He would wear like a baseball hat, but kids would take it off and stuff like that. And I think once he went to high school, he was able to be out about it. But I really wanted him to be able to go in front of his class and say, "Look, this is not my fault. My hair is falling out. Um, don't make fun of me about it. Um, I don't know why it happened, but this is who I am right now." But he wasn't able to do that, and I really worried about it. Of course, we worked very hard to get other kids to stop making fun of him and stop pulling off his hat. But um, and I when we had kids with who were had more significant learning disabilities, and they were in a special day class. I don't know if you know what that is, but um, for special education, some kids cannot function um, all day or most of the day in a regular classroom. And so there's some debate about whether kids should have to have a special class, but if they have significant enough learning problems, or maybe they're autistic or have significant emotional problems. But I would always go into the classroom that they were assigned to, because they're always assigned to a regular classroom part
mm,
of the time, and talk about this is a difference. This kid has autism. Do you know what that means? Or this kid has pretty significant learning disabilities, and get the other kids to understand what that meant. And we would talk about, so how do you treat this kid when he's in your class? How do you help include him on the playground, or her? Um, and again, having that open and candid conversation about people's differences, it helps other people understand, and other kids understand, and they don't have to make those mean judgments about them if the kid is not responding in sort of normal ways.
mm. Yeah, definitely agreed. Well, Dr. Gold, thank you so much again for taking the time to speak with me again today about these really important topics, offering your expertise and also offering some of your own personal story. It really is inspiring, and it's always a pleasure to be speaking with you.
Great, actually, very much. I hope somebody listens
Definitely,
and
definitely.
maybe get some ideas. And like I said, if anybody listens and wants to have a conversation with me, I'm more than happy to do that.
Definitely. And we'll have that information in the description as well. So for everyone back home, once again, I'm Eric Mastrota, and this has been Their Journey, a sit down with the National Digest. And like I said, for more information on Dr. Gold and to check out more of our previous podcasts and other podcasts, you could check the links in the description. Take care, everybody. Bye.
Okay.